listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank our sponsor, Aultman Health System. Today, Brad and I are broadcasting from our administrative offices, and our special guests are Andra Lloyd, Bachelor of Science of Nursing, registered nurse, and I'm thinking SCRN is stroke.
Yeah, stroke certified registered nurse, correct, yes.
Gosh, are there very many of you around? There's not, are there?
I'm not sure. It is a certification that is available to any nursing staff that want to do it. You have to take a test to be proven competent, and then you're certified.
Okay. And Ashley McConnell, Bachelor of Science of Nursing and registered nurse. Good morning and welcome to the show, ladies.
Good morning. Thanks for having us.
Thank you.
We'd like to remind our listeners today that our program is also available on our podcast. You can download that from the App Store in your favorite podcast app. Just look for Health Matters with the Medicine Center Pharmacy and subscribe to our program. So today we are talking about Aultman Hospital and their comprehensive offering for cerebrovascular services, including stroke and vascular dementia. With services like that at Aultman Vascular Lab and Aultman Stroke Center, they are a true asset to our community. They are a certified primary stroke center and offer non-invasive vascular health screenings.
So again, welcome to the show, Andrea. Please tell our listeners about your background and your career with Aultman.
Yeah, absolutely. So I started my journey with Aultman in 2011. I actually went to Aultman College of Nursing here, and a year later, I was offered a job on a unit as a nursing assistant, so a nurse's aide. I was trying to get my foot in the door, so it didn't really matter where I was working at that time. I just wanted to get the experience. And it actually ended up being a stroke unit that I started my career here at Aultman Hospital. From there, I worked on other various floors and spent most of my time working in the emergency department before coming to this role here as stroke coordinator in 2020. When I worked on that stroke unit as an aide, I was able to have a great appreciation and found the value in having a designated stroke unit in a hospital. Not all facilities are able to have a designated stroke unit. We have trained nursing staff as well as other staff that are trained in how to care for stroke patients. So in the United States, stroke is the leading cause of disability. So these patients are very complex. So they are not only dealing with the physical aspect of their disease, but also the mental and emotional toll that it takes. A lot of patients go from being independent to now needing assistance, and some family members go from family members to caregivers. So there's a lot of layers of difficulty for these patients. So our designated stroke unit is specifically trained to kind of help set patients up for success at discharge. And there's many disciplinary teams that are involved in that. So that's kind of where I started my appreciation and love for stroke patients and the complication that comes with it. And then I've been in this role since 2020. I've really enjoyed the team I work with and the opportunity we have to help the community.
So Ashley, tell us about your background and your career with Aultman.
I graduated from Aultman College of Nursing and Health Science in 2014 in the summer. And then I started at Aultman Hospital in 2015. And here at Aultman Hospital, I have worked in different roles. I've worked on the inpatient unit or on an inpatient unit. I've worked in the emergency department, and I have been in this role as a stroke coordinator for 3 years in June.
So what is a stroke coordinator?
That is a great question. So we're kind of responsible for three main categories, and then obviously we have other responsibilities. But the three main ones is our most important is education. So we assist in educating the hospital staff on how to give quality care to stroke patients. We also help educate our community. We have a really big passion to educate our community. And we'll talk more about how strokes can be prevented, but that is kind of our goal, is to help teach prevention. we'd rather not see you walk through our doors needing assistance for stroke. Obviously, we're here for it, but we like to teach the community on how to prevent it or what to do if they feel they're having it. So education is really important. The other part is we collect a lot of data, which is probably boring for some people, but we really like to look at this data to see where we can improve our care and how we can do better for patient care, and then also really highlight the great care that we're giving. And then the last aspect of the role is for stroke alerts. So if a patient comes through our doors and there is a concern for a stroke, Ashley and I will respond with the neurology team and help facilitate the process to improve patient outcomes and care. So those are kind of the three big things that we like to focus on with education, and especially the community is probably our biggest.
Yeah.
Okay. Are there different types of stroke, Ashley?
Yes, there are. So we actually talk about three different things when we're talking about stroke. The first thing that we talk about would be an ischemic stroke. These are the most common type of stroke that we see. And when I say ischemic, this is the type of stroke where you're having something that's blocking blood flow within the brain. So this could be a blood clot that's stuck there, or it could be a buildup of fat or plaque within your blood vessel. So everything downstream of that blood vessel is not getting oxygenated blood to it. This would be like if you're getting your garden hose out for, the spring, summer, and you go to try to use the nozzle and no water's coming out. And you look, investigate, and realize that something has blocked that water from coming out. That's what's happening within your brain is a blockage of blood flow. The less common type of stroke that we see is called a hemorrhagic stroke. That's a bleeding stroke. This can happen when blood vessels within your brain start to weaken, or they could burst, and you have blood that is, instead of going and traveling through your vessels to feed your brain, it can get out into your brain tissue. And this would be like if you're using that hose and instead of having a blockage, maybe you have a hole in the hose somewhere. So that water is squirting out into spaces that it's not supposed to go. And the third thing we talk about when we talk about stroke is a transient ischemic attack, or TIA. This used to be called a mini stroke, but in reality, it's not a stroke at all, but it does cause the same symptoms as stroke. So you could have a little blood clot or something traveling in your brain that could stop and prevent blood flow to the rest of the brain for a temporary amount of time. And you'll have those same signs and symptoms as a stroke. So this would be like if you're getting your hose out and you're using it in the yard, and all of a sudden the water stops flowing out of the nozzle. So you turn around and look and realize that there's a kink in the hose. What you have to do is straighten out that kink, and the water will continue to flow. And it doesn't leave lasting effects, but this is also a medical emergency. So we need to see you for this as well.
Jeez.
Can you touch on any risk factors for stroke?
Yes. So the American Heart Association estimates that up to 80% of strokes could be prevented before they even happen by managing your risk factors. Some of these things we can control, and some of these things we really can't control. So we focus on the things that we can control. The number one risk factor that we can control that causes strokes is hypertension, or high blood pressure. So make sure that you are going to your screenings with your primary care doctor. In between those screenings, you can make sure that you are checking your blood pressure at home, either with an automatic cuff, or you can go to the drugstore and use the machine there to make sure that you are not having high blood pressure on a regular basis. And if you do get diagnosed with something like high blood pressure, make sure that you're working with your doctor to lower your blood pressure, take your medications. Other things that we see that are risk factors for stroke are things like diabetes, sleep apnea, an irregular heart rhythm called atrial fibrillation, and inactivity, smoking are big risk factors too.
Okay. So how about this? Can a stroke occur at any age?
Yeah, so unfortunately, it can occur at any age. If we look at the data across the board, most strokes occur in our older population, but it can occur at any age, birth to death. The most important thing as to why that happens is because of those risk factors that Ashley just talked about. There are some other causes, though. As she said, 80% of strokes are preventable, so this can happen at any age because of those risk factors. But then there's also 20% of strokes that just happen on their own, and there's not really a way that we can prevent it. This is another great reason to continually have your annual checkups with your doctor and just know your risk factors. If you are someone who falls underneath a category of a stroke that maybe isn't preventable, knowing the signs and symptoms is the most important thing for you then, because once you know the signs and symptoms and act quickly, we could get you treated and potentially prevent some of those lasting effects. Some things that could cause a stroke is trauma. If you have an injury of your neck, it can disrupt the blood flow in the vessels that go from our heart to our brain, and a clot or plaque can break off and go into the brain. You can have an infection that could cause a clot as well. Sometimes you can have a congenital disorder where you're at a higher risk for a stroke. Or as Ashley mentioned, the irregular heart rhythm. You can have something called atrial fibrillation, where a clot can form in the heart and travel up to your brain. And then there's other risk factors that she spoke about that can just cause a stroke. So unfortunately, yes, we are not exempt at any age to potentially have a stroke. So this is why it's important to know your risk factors as well as what to do if you feel you're having a stroke.
Okay, ladies, it's time for our first break. You are listening to Health Matters with the Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Are you ready for vaccine season? I'm not ready for that yet. Are we? Where are we at on that? Coming up?
If you're talking about flu season, probably not just yet. That's usually in the winter months, but
yeah. And new vaccines have not been brought out yet either.
Not that I'm
They're coming. They just announced them though.
Oh, did they really?
They've got
Oh my
lots
gosh.
of shingles and Tdap. So
right. Okay.
Don't overlook those care things.
Talk to your doctor. See what you need to get done.
We do it too.
Yeah.
Okay. It's okay to wait and see if is it okay and wait to see someone's stroke symptoms are resolved before being evaluated at the emergency department?
No, absolutely not. You cannot wait when you are having stroke symptoms. So stroke is just as serious as someone who's having a heart attack. So your stroke symptoms that you want to look out for, we use the mnemonic B FAST. So each letter stands for something. So the B stands for sudden onset of balance difficulties. E stands for eyes. Are you having vision difficulties, blurred vision, seeing double? F stands for face, to see if your face is droopy, maybe one side or the other. A is for arms, to see if your arms are symmetrical. Can you hold them up? Do you have strength in both of them? And this could be arms or legs. We just use A, arms, to remember. S is for speech. Someone who's having a stroke may have speech difficulty, either difficulty getting the words out, or they might have slurred speech. And T is for time. Time is of the essence when you are having a stroke. For every minute that you are having a stroke, 1.9 million neurons die. And neurons are brain cells. That's tissue that cannot regenerate. That's tissue that you can't get back. So it's important that you call 911 immediately if you or someone you know is having stroke-like symptoms. So EMS can get to you quickly. They can help start to assess you. They can help get you to the hospital safely. And the other thing that they can do that really helps is they call ahead to the hospital and they say, we have a potential stroke patient coming in. And that can help alert the staff and as well as us, part of the stroke team, to know that you're coming, so we can meet you there for that initial assessment, and you can have that contact with those stroke trained providers.
So what should someone expect once they arrive in the emergency department for evaluation?
Yeah, that's a good question. So as Ashley said, if we get pre-notification or if the patient comes through triage, you will, depending on your symptoms and depending on the duration of your symptoms, you'll get immediately assessed and triaged by a stroke trained provider. and a stroke trained nurse as well. Some things to expect is they're going to get your vital signs, specifically your blood pressure. We talked a lot about high blood pressure over time causing strokes. And then they'll also want to do a neuro exam. So like she was saying, the signs and symptoms, we're going to do what's called an NIH or a stroke scale. We're going to see if you're having weakness on one side of the body or not, facial droop, vision problems, balance, coordination, all those things that she mentioned. Then you will very quickly be taken to the CAT scan machine because, as she said, there's different types of strokes and your symptoms could be similar whether you have a blockage or a bleeding. So we're going to get a CAT scan of your head and that will show us if there is bleeding in the brain. And then some other things to expect would be blood work. Something that is a stroke mimic that we talk about a lot is low blood sugar. So we want to get some blood work done to make sure that your glucose isn't low, which is a sign of sugar in the blood, and then also some testing that will maybe show us if there's something else that's causing your symptoms, chest x-ray, EKG, a couple other things. But the most important thing is you're going to get assessed, and then that CAT scan of the head is going to be kind of the priority in that. And then they might get neurology involved depending on your signs and symptoms, and to talk about treatment and next steps.
Well, it is absolutely important that a stroke victim is treated as quickly as possible, correct?
Absolutely, yes.
Okay, so if you're riding in an ambulance to the hospital, do they treat you with any meds or
So not currently, because of those two possible strokes, the bleeding stroke or the blockage of the stroke, we don't want to treat you until we get that CAT scan of your head to see if there's a cause. Because, and we can talk more about treatment, but if you're having bleeding in the brain, that treatment's going to look very different from if you have a blockage in the brain. So in the EMS, they're going to stabilize you, get you on a monitor, get some assessment ahead of time so that once you hit the door in our emergency department, we are able to start with the more stroke specific. So they'll get an IV, they'll check your heart rate, they'll check your blood pressure, and they'll do more of the emergency treatment. And then once you get to us and we do that CAT scan of your head, we can then decide for treatment. So in the squad, they don't typically start that treatment. There are some areas in the United States that have mobile stroke units and they are able to, but there's none in this area that I'm aware of.
I had a very good friend of mine who had a stroke not too far past. There was nobody around, and they didn't find her until hours later, and she passed away. She passed away. Very, very, very sad. Very sad. So
those are difficult situations for sure.
yeah. Now, you talked about neurology, the neurology team. Are they there in the emergency room right away, or is that a later situation?
Yeah, so they do respond along with us. So we're part of the neurology team, although we deal exclusively with strokes. And so the neurologist is the brain doctor, and that will be the person that will evaluate you. So we have the emergency department physician, the emergency department nurse, and then you will have a brain doctor, neurologist that will see you. And maybe Andrea or I, when we are here, will also help to assess you. So our role as the stroke coordinators, once we're down there, is to help you understand the process of what's going on if you're the patient. We help the bedside nurses with anything that they might need at the bedside. And then we also will help, implement those neurologists' orders or the plan of care once you get to the hospital.
Are they, I know the emergency rooms are very busy. Are they first to be treated, stroke victims, and of course heart attack too? That would make sense, wouldn't it?
Yes, absolutely. So we want those people. That's one of the reasons we want you to call 911 is because they can help start assessing you and call ahead and tell us what is going on with you. So they can really tell us, we have someone who's having stroke symptoms and this, they will go down the assessment and tell us exactly what is happening. And so that way the nurse that answers the phone on the other end of the line can start that triage process. In the emergency department, we do a lot of that triaging of who is is the sickest patient right now or who needs to be seen first. And certainly something like stroke symptoms is going to need to be assessed because, like you said, it is a very time-sensitive thing, and we need to treat you as soon as possible.
And something that we have here is called a stroke alert. So it's a pager that if the emergency room or even somebody in the hospital, if staff feel like they are having a stroke, we can page that and it notifies the stroke team as well as CAT scan to get that room ready for the patient to emergently go to a CAT scan. So that page is really nice because it just alerts the whole team, and then we can respond as quick as possible so that this patient can get treatment. The emergency department is very well trained in stroke treatment and recognition, but this team just helps facilitate that process to go faster and potentially have better outcomes.
Okay.
Well, I want to ask you about how stroke is treated, but we're going to need to take the news break in 35 seconds. So maybe we should just do that now.
Okay.
All right. You want to take the break now?
Yeah,
Okay.
let's go ahead and do it so we don't cut them off in the middle.
All right. It is the bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. You're listening to Health Matters with the Medicine Center Pharmacy. I am your host and pharmacist, Paul White. This morning, we are talking to Ashley McConnell and Andra Lloyd, both RNs and both with special designations.
All right. Well, we've been talking about stroke and risks and how to identify it all morning. So let's talk about treatment. How do you treat a stroke?
Yes, that is a fantastic question. So kind of going back to what we've already talked about, this depends on your signs and symptoms and the duration of your symptoms. So we keep talking about time is brain. This is a medical emergency, respond right away. We have about a 4.5 window of time from the last time that someone saw you at your complete baseline to treat you. 4.5 hours sounds like a long time, but it's actually a very short window of time. So that's why we don't want to wait to get treatment. Once you're outside of that window, it really limits what treatment we can provide to you. So depending on those factors, you may be eligible for a clot busting medication. Going back to the analogy that Ashley used, this would kind of function if that hose has the blockage, and this is only for the blockage strokes. If there is a blockage, this clot busting medication would essentially go into it'd be given through an IV. It would go through your blood vessels and it would eat up or dissolve that clot is the goal. Not everyone is a candidate for this, which is why we want to emergently evaluate you to see if you are a candidate for it. We talk about risk and benefit. We want to do what's best for the patient. Depending on where the clot has stopped, you might be eligible for a procedure where, similar to a heart cath, they go in through your blood vessels and they can pull the clot out depending on where that clot lands in your brain. And then if you have a bleeding stroke, the treatment is very different. We're not going to give you a strong clot busting medication, also known as a strong blood thinner. We're going to try to decrease the amount of pressure in your brain. So similar to that garden hose that has that leak, we're not going to turn the faucet up and push more fluid out of there. We want to kind of decrease that. So we're going to bring your blood pressure down a little bit to protect the brain. And you might need to get a procedure done to either remove some of the blood in the brain that's in the wrong locations of the brain, or other procedures to kind of help support it. So treatment is different for ischemic and hemorrhagic strokes. Again, cannot stress enough. That's why it's important to get evaluated as soon as possible.
What's typical size of the?
Why do some patients need to be put?
Go ahead.
Go ahead.
What is a typical size of a clot in the brain? Is it typical, or is it just everything, every size?
Yeah, so it just depends. So we have different sized vessels in our brain. So where that clot lands, it could vary in sizes. It just depends on the origin of it. So if we have a blood clot that comes from our heart, they can be a little bit larger as they go up into the brain. But as far as size go, it just depends on the origin and then the vessel that it stops in. There are certain vessels in our brain that are considered large vessels. So patients who have clots that stop in these larger vessels will see larger symptoms and a higher NIH. We talked about that stroke risk factor, or the stroke factor, the stroke scale. You can have a higher scale, meaning more severe symptoms. So Not necessarily the size of the clot, but the size of the vessel that it stops in and the tissue around it, what it controls, because tissue in our brain controls the things in our bodies. So depending on where that clot stops, you can kind of tell the difference in the severity of it.
But a stroke is always in the brain, or can it be somewhere else?
So when we talk about strokes, in the brain, then it's anything from the base of your skull up. So you can have a clot that stops in your leg. That would be called a DVT, or deep vein thrombosis. You can have a clot that stops in your heart and your lungs. There's other locations, but what we are talking about today is just stroke. So any clot that stops in your brain, our major vessels that come up off of our heart is called our carotid arteries. So sometimes when you get admitted, they'll look at those arteries to see if there's some problem with the flow there going into the brain. So when we talk about stroke, this is strictly just the brain.
Okay, why would a patient need to be put in the intensive care unit for treatment?
The intensive care unit is the highest level of care within the hospital. So these patients, for a various number of reasons, need that close monitoring. So you would either be a one patient to one nurse, or maybe two patients to one nurse. That way you have a whole care team that's keeping an eye on you very closely. And they're going to monitor your mental status. They're going to monitor your stroke symptoms, and they're going to monitor your vital signs. And that blood pressure is really important when we're talking about stroke. I know we've said it several times, but those patients that are there, they can have that close monitoring. And then if you're more stable, at some point you usually can be moved out of the intensive care unit and into the designated stroke unit, where we also still have that ability to complete your testing, monitor your heart and vital signs, and you will still be cared for by stroke trained nurses.
Can you give us some general ideas on what recovering from a stroke is like? I'm quite certain it's different for every patient, but some generalities maybe.
Yes, absolutely different for every patient. So it's important to remember that if you've had a stroke, it is definitely a marathon and not a sprint. We do see where patients typically have the most improvement within the first 3 to 6 months after their stroke. So that is why it is really important during this time that we are making sure that we're completing, rehabilitation, physical therapy, occupational therapy, speech therapy, and that way we can help kind of train our brain to work in a different way. Because once we've had that stroke, there's those, that statistic is 1.9 million neurons have died for every minute that you have had a stroke. And, potentially that stroke is left untreated. So, there are some people who don't recover at all from a stroke. There are some people who have partial recovery, but still have lasting effects from the stroke. So it is going to be different for everyone, but it is important that we try to get you functioning in the best way possible with your new normal. And the way we do that is through that rehabilitation process.
It seems to me that most stroke victims have vocal issues, talking issues. Is that true?
It can be, and it depends on the location of the stroke. So, everything in our brain controls something in our body. So for some people, they could have a stroke that affects the language center of their brain. So maybe they can't get words out. Or maybe they have the language center within our brain where they can't understand what you're saying to them. The other thing that happens is it's not so much of a language problem, but some people have a stroke and then they have facial muscle weakness. So maybe they have that facial droop, which is causing them to have weakness, and it causes their speech to sound slurred and not very clear. So just depending on where you've had the stroke is what can cause those symptoms. And there's no way to predict, where you would have a stroke. So maybe someone, isn't managing their risk factors and may think, oh, it's no big deal. But we don't actually know where the stroke will occur and what effect it will have on you until it happens.
So what can people do who've had a stroke? What can they do to prevent it from happening again?
This is what we get very excited about is prevention and secondary prevention. So once you have a stroke, you're at risk of having another stroke. So it really goes back to those risk factors that we already talked about. Continually see your doctor, manage your risk factors, choose some lifestyle changes to help promote a healthy life and healthy brain. So understanding your risk factors is important. I think the more that we know, the better choices we can make in our medical care. So understanding your risk factors and then controlling them as well.
Here's a good question. What can people do who already have had a pretty good health to keep their brains healthy?
Yes, there's a couple of things that you can do to help keep that brain healthy. I would say make sure that you're staying active as a person, making sure that you're incorporating movement into your life. Make sure that you are able to have those regular checkups with your doctor, at least yearly. Some people are healthy individuals, but they might have underlying disease processes that they're not aware of. So making sure that you're having those blood pressure screenings and blood work at your doctor's office. That way, if you do end up being diagnosed with a long-term medical disease, you can manage it either through medications, through diet and exercise, and working closely with your doctor. So some people, they may feel like they are healthy as a horse, but it's still important to follow up with your doctor, as well as staying active and making sure that you have a good support system to help keep that brain active and functioning well.
Okay, so what other types of exercises are recommended? I mean, we can't just exercise our brain, can we?
Right. That is something that Ashley and I have talked a lot about because the American Heart Association recommends, I think it's 150 hours a week of moderate to intense exercise. Not everyone is capable of doing that, so we always recommend starting small, setting small goals, and even having a friend kind of join in on these small goals, and it helps you stay a little bit accountable, and these goals are easier met if they're smaller. So we do daily walks, just a 30-minute walk every day. I think it's broken down into 40 minutes over 3 to 5 days or 30 minutes over 5 days. Starting small, you don't need to get a gym membership today, but just start small, do some walking. Swimming is great as well. Anything that is considered a cardiac or a cardio workout. Remember, strokes happen in our vessels. So the healthier we keep our blood vessels, keep our heart pumping strong, keep our blood pressure good, the healthier our blood vessels are, the less risk of stroke we have. So any type of cardio is great. Swimming, low intensity jogging, walking, things like that, just to help keep our circulation and blood flowing.
Okay, guess our final break is here. You're listening to Health Matters with the Medicine Center Pharmacy. Okay, welcome back to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. Today we are talking with Andra Lloyd and Ashley McConnell, both registered nurses. And thanks for joining us today.
Thank you for having us.
All right, let's talk about healthy eating to support a healthy brain. What tips can you share with the listeners today?
The American Heart Association recommends that you could follow the Mediterranean diet. And when you look that up, that's a diet that's really high in leafy green vegetables, low in processed foods, low in those saturated fats. A general rule, if you don't necessarily know what the Mediterranean diet is to make sure that you're eating low salt or low sodium foods, making sure that you're incorporating those fruits and vegetables into every meal, and make sure that you speak with your doctor about changes that you can make to your diet. Some insurance companies will even cover for you to meet with a dietitian or a specialist that can go over the best nutrition for you as a person.
Okay. At our news break, I heard him talking about someone who was trying to smuggle a bunch of cigarettes in the country. And I think as a pharmacist, it still frustrates me with, I don't know. I know we all have our stresses and vices, but can you talk about smoking and how much of a bad idea it is for overall health, let alone effects on stroke?
Yes, very passionate about that. So a couple of things. The first thing is the chemical in tobacco actually causes hardening or narrowing of our blood vessels. And remember, we're talking about blood vessels, blockage in the blood vessel. That narrowing or hardening of this blood vessel is not good. That can lead to a clot. The other thing that the chemical in tobacco does, and I do also want to point out that this is also vaping. So not only cigarette smoke, but also tobacco that is in vape pens or vaping. It can also thicken our blood and cause those clots to form. So those two things is what tobacco has on effect on our blood. And it also causes high blood pressure. I mean, I think we've talked about it enough. We know high blood pressure is a major risk factor. So that alone, there's not really a benefit that I'm aware of for smoking tobacco, but there are a lot of risks that come with it, and stroke is one of the bigger ones. So we have options on how to help you stop smoking, and I think it's important to look into them.
You know, both of you ladies have a lot of certifications and are really experts at what you're doing, but I'm a pharmacist and I'm also certified in picking up cigarette butts. And I've been doing this on parking lots ever since I was 14 years old when I worked at
Really?
Taggart. It's
Wow.
just crazy. And then the Army really trains you in that.
Mhm.
So anyway, I can't figure out why people just continue to smoke. I
Mhm.
mean,
We've talked about that before
Yeah.
too, that we are always surprised at the amount of people that are still smoking, amount of people that, you know, are maybe our age, and smokers.
Yeah.
So it's important to quit. It rapidly reduces your
Yes.
risk of stroke once you quit.
well,
You know, it really benefits your health to not smoke.
and we know so much about the damage that cigarettes and tobacco causes,
Mhm.
even chewable tobacco and stuff like
Yeah.
that. So it's just crazy, really. I try to correct everybody I can, but a lot of them get angry, I would think. Okay. Anyway, go ahead, Brad.
All right. Well, I'm pretty confident that Aultman has some resources to help people if they want to stop smoking. So, can you talk about that?
Yeah, we absolutely do. We do have outpatient resources. So the outpatient means that for those people who aren't necessarily admitted into the hospital, Aultman does offer resources for those patients who maybe want to stop smoking. So we have a program called Give It Up, and it is led by a smoking cessation expert. And these can be group sessions. So these group sessions can go over the course of a couple of weeks. You spend an hour at a time, you know, with other people that may be trying to quit smoking and kind of learn resources, things that you can use. You know, there certainly are, you know, medications, there are prescriptions that you can use to try to help you quit smoking. And sometimes just having that support group is really important too. And like I said, once you stop smoking, your risk of stroke is rapidly reduced. And that the benefits only continue the longer you are not smoking. You can find that Give It Up program, by the way. I don't think I mentioned this, but you can find it online. So you can just go to Aultman's website. You can type in Aultman smoking cessation, or you can say Aultman Give It Up, and you can register online there if you're interested.
So, how do communities such as support groups help patients in recovery after a stroke?
This is so important. As we talked about, strokes are a disabling disease, but it also brings along with it emotional and social and physical, all of the aspects it affects in our lives, not just the physical aspect of it. Aultman Woodlawn is Aultman's rehab center, and they host a support group where patients survivors of strokes as well as caregivers can go and they can learn about community resources. They can meet with other survivors and kind of build that relationship with people who have gone through similar situations. Again, this is a very taxing and mentally hard disease that affects you so much. And I already said this before, but you could go from being completely independent to needing somebody's help at all times. And that really takes a mental toll on anyone of any age. And family members who maybe weren't expecting you to become caregivers are now caregivers. So this supports both the person affected by the stroke as well as the caregiver. And they just have a lot of neat opportunities and resources in our community that maybe not a lot of people are aware of, that are resources for them to just help support them and make their new normal more manageable.
How do we, okay, a patient comes into the hospital emergency room and really has blood in the brain. I mean, deep in the brain, or a clot deep in the brain.
Mhm.
What do we do next?
Depending on a couple of factors. So remember that 4.5 hour window that we talked about? So if you're in that 4.5 hour window, we're going to do a very quick assessment on if the risk of giving you this clot busting medication is going to be beneficial for you or not. If the risk is too high or you're outside of that 4.5 hour window, we're going to start by controlling your blood pressure and protecting your brain as much as possible afterwards. And then again, if the clot stops in one of our larger vessels, we can actually have that clot removed. And I remember you speaking in the beginning that we are non-invasive vascular. So if a patient is found to have a clot in their large vessel, they will be transferred from our facility to another facility to have that clot removed and continue that care. And then if there's bleeding, we're going to control your blood pressure, potentially take the blood out of the brain with the procedure, or help get that pressure off the brain with different procedures that can be done here or elsewhere as well. So it just depends on signs and symptoms, the duration of your signs and symptoms, what type of stroke, and location.
The lady I was talking about earlier that passed away, a good friend of mine, she did have, because of an injury also, a lot of blood in the brain when they found her, and it just was no hope for her at all. And that's really a sad one. So
it is. It's unfortunate. Yeah, once
yeah.
the blood is supposed to stay in our blood vessels, and once it goes into the brain, it can cause that pressure on the brain, and that pressure is can be very detrimental to patients. So I'm sorry to hear about your friend who experienced that. That it's probably a little bit more hits to home, this conversation, I'm sure.
Yeah, she was a high school friend,
No.
and that's just really, really sad, and just
Yeah.
there was nobody there to help her.
Yeah, that's
It was an accident. Truly, it just wasn't. There wasn't anybody there. What do you do? So
yeah, that's difficult.
does somebody watch you all the time, or I just
That is a tough one.
yeah.
I mean, they have life alerts that you can use. There's lots of
Mm,
options, but I can't give you a one answer to fix all your problems
Yeah,
sometimes.
unfortunately, we
yeah.
can't predict, we
Yeah,
can't predict when it's going to happen, if it's
right.
going to happen.
Yeah.
So that's why we push so hard on that prevention. If you can prevent it, if you can manage these things, that's going to be your best bet.
Is the person that has had a stroke prone to having another stroke?
Yes, absolutely. I think your risk goes up 30% after your first stroke. You're at a risk of having another stroke at 30%. Another thing is Ashley talked about those TIAs, so those symptoms that come and go. We call those warning signs or warning strokes. Even though the symptoms have resolved and you think, hey, I'm in the clear, that is really a warning that your brain and body is giving you, like, hey, there is a problem and it needs addressed, or it could potentially lead to a more severe stroke. So yeah.
Okay.
All right, ladies, any final words you'd like to share with the listeners before we wrap up?
Yeah.
Yes. Remember your stroke symptoms, your stroke, those signs that be fast, balance, eyes, face. Are you symmetrical? Are you able to speak clearly? And remember that T and be fast is time. It's a very time sensitive thing. For every minute that a stroke is left untreated, 1.9 million brain cells are dying. So make sure that you are calling 911 to get to the hospital immediately. We are very lucky in our area that we have options as far as hospitals, and we have, stroke centers close. So remember that we do have Aultman in Canton, Maslin, and Orville. These are stroke centers that can help treat you if you're having your stroke-like symptoms.
Jeez. Okay. Thank you very much, Andrea Lloyd and Ashley McConnell. We enjoyed the discussion very much, and we're very glad you could come on.
Yeah, thank you guys so much for having us, and happy Stroke Awareness Month.
Oh, is that what this is?
May is Stroke Awareness, yeah.
Okay, my gosh. All right.
Thank you guys.
Thank you.
I think it's just been Nurses Month too.
Yes, that was last week, and this week is Hospital Week. So
and it's also Neuroscience Nurses Week. So we're happy
just celebrating.
All in one month.
Yep.
Okay. If you suspect you have a medical issue, please contact your health care provider. Thanks to Aultman Health Systems, and listen for joining us on Health Matters and the Medicine Center Pharmacy. Have a healthy week. We'll see you again next Friday right here on News Talk 1480 WHBC. Thank you very much again. I enjoyed it, and I'm sure our listeners enjoyed it.